And in terms of a collaboration of the clinicians internationally, because we work with the international colleagues in a similar background, I wish to see more active involvement of a Singapore clinician on a world stage. When I raise this question, many Singapore clinicians deny that, but believe me, I work with the other clinicians outside of Singapore as well. Compared to maybe Chinese clinicians, maybe even Korean clinicians, I see them with a lot of active interaction with the U.S. In a clinical practice, and they're closely connected to that. How would you say that? What do you think?
I think Singapore actually has a very strong place in the international medical scene because the healthcare system is very well regarded, and many of the Singapore clinicians, when they finish their training, do go overseas to different centers in the US, in the UK, Australia, Japan, all across the world to learn from experts in their field, and that's why the healthcare system here is so robust. I think you may see a little bit stronger presence and participation from other countries, largely because it's a numbers game. Singapore is still a very small country, but its size also does lend itself to certain strengths as well. Because of the infrastructure, because of the size, because of consistent patient numbers, its reputation, doing things like running clinical trials, getting validation, being able to track your patients well, being able to follow them up, and being able to publish that in an ecosystem that really encourages research and innovation is tremendously powerful. And that's why, even though Singapore is small, there are numerous centers and departments here that are known globally.
Yeah, that's great to know, because I really believe that the Singapore does have a true potential to be the global powerhouse. When it comes to innovators, because we work with a lot of young entrepreneurial skill innovators that have an engineering background, particularly for the medtech space, but they actually have, with some exceptions, just like in everything in life, there's some exceptions, but most of the innovators, they don't have any clue about how to commercialize the product. Same thing with the clinicians too. Although clinicians' opinions are probably count a lot more than the innovators when it comes to really applying that to the patient in a hospital setting, but it is very difficult for us to convince both parts who are lacking the full understanding of what does it take to commercialize a product, which is very important, because without commercializing the product, it doesn't really matter very much unless you're a charity, doing everything for free. How can we improve that setting, or do you see any improvement in that area over the past years in Singapore? Or?
When you have startups working with clinicians, different perspectives will always drive conflict. I think commercializing a medical device or a digital health product is the hardest part of the journey. And you could have the best idea, the most innovative product, but if you can't get it to patients, it's all for nothing. And I think it's really challenging because it is very understandably complex. And there's not a whole lot of information out there for startups or clinicians who want to innovate as well. And one of the most valuable things I learned in my journey was the Stanford biodesign process. When I did my fellowship, it really gave me a very structured approach into looking at needs-based innovation, finding a problem, creating a solution, and not just creating that solution that it was attractive to payers and patients and providers, but also figuring out how to commercialize it. What I do think is valuable for getting clinicians to be more involved and more open to new technologies is giving them that opportunity to give feedback, because everybody wants to be heard, to say, hey, I think you can adjust it this way. And this can be valuable because early clinician engagement through platforms like VentureBlick allow products to evolve and change early on, allow them to change and find new business use cases or figure out problems with the workflow and improve on those. And when people are heard, they're more receptive. And I really think that when you involve them early on, you're really making it easier for them to want to adopt and use your technologies later on down the line.